Hello, how are you? Many people suffer daily from snoring, acid reflux, and back pain, and they don't realize that sleeping in the wrong position can make these problems much worse. There is a more effective way to improve how our body functions and prevent these issues. I'll tell you all about it. You're going to love this video because I'm also going to tell you something else, what you can do before going to bed to improve your sleep. So stay with me until the end. You won't want to miss this. Before we start, I want to ask you, what position do you sleep in? Do you usually have an ideal sleeping position, or does it change every night? What is your position? I would love to see your comment. Remember to like the video. It really helps me out here on the channel. And share this video with anyone you know who will like it and needs it. Let's grow this chain of kindness. That's what I want here on the channel. Like I told you, there is one position that is among the worst for us to sleep in. It can make reflux, gastritis, and back pain worse. It can really make things worse. Even your sleep can become more fragmented, which can raise your blood pressure and increase the risk of sleep apnea. But there is a position that can really help with all of this. So, I'm going to start by telling you which is the worst sleeping position. It's definitely the prone position. Tell me if you sleep on your stomach, or as they say, face down. When we sleep in this position, our neck ends up excessively rotated. We turn our neck a lot just to be able to rest like that on the pillow. It throws off the natural curvature of our spine. It also increases tension in the cervical and lumbar regions, and it leads to episodes of pain upon waking up. Besides that, there's the issue of your face being pressed against the pillow all night, which makes things worse. There's the dermatological aspect too. Your skin doesn't breathe as well. It's in constant contact with the bacteria on the pillow, so you need to be even more careful with hygiene. It also promotes wrinkles and expression lines on your face. So if you're someone who's concerned about aesthetics and wrinkles, sleeping on your stomach is the worst position for you. On top of that, there's also the issue of pressing on your stomach, which can make your breathing worse. So in fact, out of all the positions, it's the worst one for you to sleep in. There are even people who, over the years, develop shoulder problems from keeping their arm up or down under the pillow to try to find a more balanced position. If the pillow size is wrong, either too high or too low, it can make the misalignment of your spine and neck even worse. So if you can, don't sleep on your stomach. I know it can be hard to change over time. One way you can try to avoid sleeping on your stomach, which is the worst position, you can try placing some pillow supports around you, put a pillow behind your back, hug one in front to help keep yourself in a more neutral, more natural position and prevent your body from turning over during the night. And so you don't wake up already in that stomach sleeping position. Sleeping on your back, that is, with your belly facing up, has both positive and negative aspects. This position can be beneficial for spinal alignment, especially if the pillow is at the proper height, that is, not too high, which could strain your neck, and not too low, which could also cause your neck to bend downward unnaturally. It can help those who have mild cervical or lumbar pain, but it can make snoring much worse because since all your body weight is on your back, it can impair the filling of the lungs, it can affect the diaphragm. Especially if you are overweight, if you have fat accumulation in the central visceral area in the abdominal region. It can increase the risk of sleep apnea and may also lead to spikes in blood pressure during the night, precisely because the difficulty in reaching deeper stages of sleep caused by apnea and poor oxygenation puts additional stress on the body. And for pregnant women, it's not a very recommended position because it can compress the inferior vena cava, which is related to venous return. We know that pregnant women already have an enlarged belly. Obviously, there's a baby in there, there's the uterus, everything shifts around. So there's already a greater tendency for this compression of the inferior vena cava. So, the venous return in pregnant women is already worsened. This is physiological during pregnancy. It goes back to normal after the baby is delivered and the uterus shrinks. But if you still sleep on your back, it can make things worse and aggravate issues like swollen legs, fatigue, and poor circulation. That's why it's not the best position to sleep in if you snore, if you have sleep apnea, if you have significant reflux, and if you are pregnant. There is a position that is usually good for many people, for the vast majority of people, which is sleeping on your side. But there is a right side for you to sleep on that can be even better for your health. People can sleep on their side either on the right arm or on the left arm. There are some differences, especially when it comes to gastrointestinal issues, right? That's because when you sleep on your right side, it can be okay, but there's a warning. Because when we sleep on our side, in general, it's good for the spine, especially when you have some support for your spine, like I mentioned to you. And especially if you put a thin pillow between your legs to keep your knees from knocking together. Now, the stomach and the lower esophageal sphincter can promote acid reflux into your esophagus when you sleep on your right side. So, observational studies have already shown a higher frequency of nighttime reflux and sensations of heartburn, throat clearing, and coughing upon waking up. So, if you don't suffer from reflux, it might be okay, but if you have reflux, a hiatal hernia, or any other associated gastroesophageal issue, it can make your condition worse. That's why usually specialists recommend that people do sleep on their side, but on the left side. Because in this way, you can make it harder for stomach acid to flow back into the esophagus, naturally improve the sensation of gastric emptying, everything flows more naturally in the body, and reduce episodes of nighttime reflux. In addition, sleeping on your side can decrease episodes of snoring. For many people, it promotes venous return and circulation. And it's the most recommended position for pregnant women. So it can be interesting because for many people, since it promotes venous return, it can also help with swelling in the legs. For those who suffer from swollen legs, heaviness in the legs, that feeling of congestion in the legs. So ideally, you should sleep on this side, on your left side, with a pillow for support. Be careful when you sleep on your side too. Once again, make sure to pay attention to the height of your pillow so that your head, neck, and spine stay properly aligned. You have to keep in mind that your spine should stay as aligned as possible. So the size of the pillow is important. Not too high, not too low, once again, so you don't strain your neck. This will be very important for you. Now, regarding what to do before bed to help you have a good night's sleep, one tip I have for you, which is very important, is to avoid eating right before bedtime. So, ideally, if you're going to have a big meal, you should wait at least 3 hours before going to bed, giving your body enough time to digest so your stomach isn't too full and you don't worsen issues like reflux or even intestinal discomfort during sleep. So, the best thing is to eat light foods, richer in fiber and lean proteins, and avoid large amounts of fat before going to bed. We know that fat has a much slower gastric emptying, as do all fattier foods. They stay in your stomach for a long time and can promote reflux and worsen your sleep during the night. Remember, if you want more tips on how to sleep better, I have a playlist here on how to sleep well. In this playlist, I give tips not only about your bedroom, environment tips, sleep hygiene that you can practice, but also about food, teas, the best and worst foods that can help you in this regard. So I'm going to leave this playlist on how to sleep better, how to improve your sleep down below to help you. Tell me, are you going to try sleeping on your left side? What sleep position do you find it easiest to fall asleep in? Some people say, "Oh, Patricia, I want to change my position, but it's hard." It really is quite hard to change our habits, especially those nighttime routines, isn't it? That's because they end up being deeply connected to a certain natural predisposition that we already have built into our systems. Some people sleep for years in the same position and end up starting to sleep one way, but wake up in the position they used to sleep in before. So, I'm telling you now, there's a kind of muscle memory involved, and there's a memory related to the very position your body gets used to, and it can take a few weeks, so don't give up, okay? It won't be on the first or second day that you'll be able to change, but keep trying to sleep in that position, support your body with pillows or cushions to try to stay in that position. You'll see that as time goes by, you'll start waking up in the position that's most favorable for you. So, write down the position you sleep in. I would love to see your comment. Don't forget to like the video, it helps me out, and share it with those who will enjoy it and those who need it. Let's grow this chain of kindness. That's what I want here on the channel. See you next time. Bye.